Well, you filed your claim with the VA, and it might be time you're waiting for what they call a C&P exam. Have you ever been to one of those? Probably not. Is it confusing? A little bit. Can you get through it? Yes, you can. Well, you're a veteran. You just got out of the military maybe last month, last year, maybe 5, 10, 15, 20 years ago. However, you got a claim you're trying to file with the VA. You already opened the claim up, and now it's time. They're going to send you to what they call a C&P exam. That sounds pretty technical, right? Sounds a little overloaded for our mind at veterans our age, but that's the process. It's called a C&P exam. Now, a C&P exam is given by a doctor outside of the VA. So look at it kind of like this. The VA doesn't want to get involved in the middle of the attorney on one side and the client on the other, so they send you to an outside doctor. Most likely going to be serviced by like OptumServe, LHI, or some other organization just like that out there. That confuses you even more. Now, this examiner, he's going to try to debunk your myth, or he's going to try to put negative things into your story or your claim so that the VA does not have to pay it. So the more evidence you can prove, the more problems you have. Don't lie now. Be honest with them. But the more stuff you can prove in that C&P exam, the more likely it is your claim is going to get paid. Now, the VA is not going to just roll over and give you a positive rate for that claim. They're going to make you work for it. I guarantee you. They're going to make you work real hard for it. They don't give away nothing. Give you an example. I got out in 81, had tinnitus and hearing loss. However, it turned into a couple of other things. Okay, got cut off there, but back to what I was saying. I got out of the military back in 81. And I had hearing loss and tinnitus. Now, since then, a lot of things have deteriorated. Hearing loss has gotten way worse, but at the same time, I've gotten a lot of migraine headaches and suffer from insomnia since about 2012. Now, I personally didn't know that these things were secondary to the existing conditions that I got when I left the military. Now, look at the picture here. It's been 30-something years. Could have been claiming this a long time ago, but did not have internet back there when I got out of the military, and didn't have all the channels we have nowadays to help with these claims. There's a lot of people out there that can help you, but I lost a lot of stuff, a lot of time, and a lot of money probably by not filing that claim earlier in my lifetime. So don't make the same mistakes I'm making there. Don't miss out on your claim. So back to what I say in a C&P exam. Now they're going to send you to this examiner, and let's just say migraines. I guess that's a pretty good example. And they're going to send you to the C&P examiner out there to check your migraines. He's going to ask you a bunch of questions, and he's going to go down what they call a DBQ. Now, a disability benefits questionnaire. Pretty simple to remember, even though my mind is not like it used to be. I can remember it sometimes I can't. Now, he's going to ask you some off-the-wall questions. Now, you can get this form before you go to that C&P exam, so you're going to be aware of what questions he may be asking you, and you might want to prepare yourself, because if you're as forgetful as I am, you will not remember what you need to tell him. Especially if you suffer from insomnia or something like that, and you get there and your mind goes blank, and your mind may go blank even if you don't suffer from anything, period, because that is pretty tough to sit there in front of somebody that knows they have your future, your life in their hands. So you're going to want to answer the best you can, and you're going to want to have the strongest replies to the questions he has that you can. Don't get sidetracked. Sit there and focus on it. I know some of us out there may have some mental incapabilities, but do the best you can. The C&P exam will determine if the VA is going to actually help you with the claim that you just filed, or in this situation here, migraine headaches. Something else you're going to want to make sure you do is from the minute you get out of your vehicle in that parking lot, and let's say, for instance, you have a major back condition and you can't drive for long periods of time, but this exam is scheduled maybe 3 hours from your home, 2 to 3 hours from your home. Now, it is not recommended that you drive yourself to this C&P exam, because chances are, being that they're trying to debunk your theory, or in other words, deny your claim and not have information that will help you, they're going to be working against you, like a prosecuting attorney does if you have a case in court. Have your wife, have your friend, have your brother, have somebody drive you to your claim if it is something that you are claiming. Make sure they don't want to see you drive in a sports car up there, get out, walk across the parking lot, and then you get inside acting like you got back problems, folks. If you have a claim, you have a claim. If you don't have a claim, don't file a bogus claim. You know what I mean? So, for instance, If you've been assigned a cane by your doctor to help you walk, use that cane. If you've got hearing aids to help you hear, use those hearing aids. Use what they give you, the tools that they recommend to you for your disability. Make sure you're using them at the time of that C&P exam. When you go in there, that C&P examiner is also going to ask you, how you doing today, sir? And I bet you're going to come back and say, oh, I'm just doing fine. That's not the correct answer. You would not be going to a C&P exam if you was doing just fine. Chances are you got something going on up there that's not clicking up in that brain. So make sure you respond to what he's asking you. If he asks you, how you doing today, sir? I'll just come back and say myself, I'm not doing too good, or else I wouldn't be here. Or you might say something that affects that. I'm not sure. Depends on your claim. But you damn sure don't want to go in there and say, hey, I'm just doing fine today. Because he's going to mark that down on that piece of paper, that DBQ, and that's going to go back to the doctors or the VA who's going to make that rating decision. So you damn sure don't go in there and tell him you're doing okay. Something else you don't want to do. Now, you see me, I'm dressed in this t-shirt right here. I wear shorts that are probably about 4 years old. And that's just me. The only time I'm ever going to dress up a little bit is when I go to church. So if you're going to a C&P exam, don't put your Sunday clothes on. Go like you'd normally dress like you normally would, and go to that C&P exam just like that. Because he's going to be judging you from the minute you walk in that room. Actually, he's going to be judging you from the minute you get out of your car in the parking lot. Chances are they're going to have cameras out there. And he's going to be watching you come in that office. You got an appointment time for a reason, folks. He sees you got an appointment at 2:30. The show begins when you drive in the parking lot. Not when you get out of the car and go inside. It begins when you drive in the parking lot. So, he's going to judge you on your appearance when you walk in there for the C&P exam. Well, I got sidetracked there, and hopefully I didn't get too confused on where I left off at, because that's part of the reason why I'm trying to file a claim, or I have filed a claim with the VA. I got pretty bad memory loss, but we're going to see if we can continue. We try to read off a script as much as we can here in this video, but sometimes we get a little sidetracked. But again, I'm going to probably cover some of the sections that we just talked about. Your exam starts from the minute you get out of the car or you drive in the parking lot. It continues as you're in the clinic, and it continues all the way till you get in your car and you leave the parking lot. That examiner is going to try to be your friend. He is not your friend. He is there to contradict your claim. Anything he can write on that claim that is negative, he will use that against you. You are the actual opposite of him. You're trying to present your case in the best way you possibly can with all the evidence you have. His job is to debunk that side of it. In other words, he's trying to prove you do not have what you're saying you have. Then he will pass that evidence back to the actual decision board, whoever's going to make that decision on your disability, and that's how it's going to be handled. So it's in your best interest to study up, look, learn, follow a few videos out there on YouTube just like we're making right here, and it possibly could help your claim in the long run. Guys, don't underplay, don't overplay your situation. Present the facts as they are, and chances are you may win that disability case. If not, you can always reapply the second time if it's denied and appeal the case. But there are a lot of things out there on YouTube right now that will help you win your case. Evidence, presenting yourself, a lot of things. I can't cover them all in this video, but if you have any questions, comments, we ask that you post them down below. There's probably a lot of veterans out there that are going through the same thing you might be going through, that I've been going through, and I'm trying to create these videos to help y'all out as much as I can, because it's lots of information out there, and I'll go in a little more depth. When you put your case in through VSO, or you file your case yourself, or whoever might file your case, they're going to be asking for DBQs, Nexus letters, and there's so many companies out there right now that really want to stick it to you, man. I mean, really stick it to you on Nexus letters. I am going through a secondary claim right now, and I'm using a lady doctor that she's recognized for 20-something years in her field, and if for some reason I feel comfortable with her and I don't feel she's overly priced, I may put her information down in the description below. But I have seen some organizations out there that charge you 20% or say 5 times the difference that they claim. In other words, if you have a claim, if you're getting disability right now of $1,000 a month and you're trying to get an increase, and your increase goes up to $2,000 a month, a secondary tied to the existing claim, then that company wants to charge you 5 times the positive benefit. In other words, you increase it by 1,000, so they're going to charge you 1,000 times 5. They're going to make $5,000 on your claim that they hardly did anything for. Now, I don't feel that that is correctly done. We are veterans. We deserve what we deserve. We've earned it. But there's so many companies out there, and don't be fooled by these companies. They'll lock you in, and next thing you know, you're going to be paying them $5,000, $10,000, $15,000, that money that you could have been pocketing yourself. It's called selfishness and greed. So be careful who you choose to write your Nexus letters, your DBQs. Be careful who you work with, because not everybody out there is your damn friend in this world in the good old USA. It ain't like it used to be 30 years ago when we could take a handshake and had a contract. Guys, I rambled on enough. Down below is the description. Comments, post them down there. I'll read them. I'll respond to them. I don't care if the comments are positive or negative. I am who I am. Not trying to be anybody I'm not. Well, guys, thumbs up, like, subscribe. Hopefully I'll see you in my next video. God bless you all. Thank you.